Hello and welcome to Academic English. Today we are going to look at Speaking Roleplay 1. We will discuss the organization of the response, look at some sample charts that you could receive during the exam, and also talk about the questions that you could ask for each category. So in CELBAN Speaking, once you have your introductory questions and the probing 1 question, which is a description question, you will have something called Roleplay 1. This is a patient interview in which you are the nurse and you are interviewing the examiner. Now, I would advise to spend about 7 to 10 minutes in this roleplay. They don't give you a specific time, but in order to have everything done correctly, the organization, all the elements that you need to incorporate in this role play, you will need about 7 to 10 minutes. And remember, the overall speaking test is 25 to 30 minutes. The CLB level you need for speaking, as you already know, it's CLB level 8. It is important for this role play to use the proper organization and all the required strategies, which we will discuss in a little bit. Try to keep it as a conversation, and even though you may be tempted sometimes, avoid giving advice in this role play. You are just getting the information from the patient. It is important to pay attention to your question formation because grammar and intelligibility are marked quite high. Now the charts typically look like this. You might think that this chart it's actually easier, but it's not. You will see in a little bit. This chart, you may look a bit busy, but it's actually quite easy. These are the newer type charts, and these are the older type charts, but they still use both of them, so be prepared for both. So this is what a typical Roleplay 1 chart looks like. You will have some categories on the side, and the rest of it, it's quite empty. You might have some subcategories to guide you as you ask the questions from the patient, but typically it's just empty here. The categories, it's important to familiarize yourself with the categories. Every chart is different, but some categories make an appearance more than once. For example, pain level, it's quite a common category. History of present illness, symptoms, even lifestyle. This is another type of chart which you may get in Roleplay 1 for CELBAN. This is from their latest handouts, available for purchase from CELBAN Center. It's not the full chart because it doesn't fit in my screen for you to be able to still read it. But as you can see, it may look quite busy, but it actually helps you quite a bit more than the chart that looked quite empty, the one I showed you earlier, because it guides you a little bit more with your questions. So you see, these are the categories, and then it guides you a little bit. Meanwhile, this one, it's a little bit more difficult to come up with the questions for it because there's not a lot of guidance. It's a lot easier if you do receive a chart like this in the actual exam to ask the appropriate questions and make sure you don't miss any of the information. Now, the organization of your Roleplay 1, it's actually quite similar to the organization of Roleplay 2. If you haven't watched that video, I would strongly encourage you to watch it. There's some components in that video that we don't cover in this video. The introduction and the ending for Roleplay 1 and Roleplay 2 are quite similar. In Roleplay 1, in the introduction, you will first introduce yourself. So you could say something like, "Hi, my name is," and you can say your first name. "I'm one of the nurses in this." Try to keep in mind, are you in a medical ward, emergency department? Listen to the instructions so that you know the scenario. And I'll be your nurse today. The next part is to verify the patient's name. So you could say something like, "I would like to see whether I'm talking to the correct patient. So could you please state your name?" And then the patient will give you their full name. Then you can ask, "How would you like me to call you?" The next component in the introduction for Roleplay 1 is to explain why you are there. Try to look at the chart and try to understand why are you asking these questions to the patient today. And try to think, why am I here? Why do I need to ask these questions? So if you look at the instructions for this chart, you will see that you are a nurse in a medical ward. Your patient was admitted with a diagnosis of pneumonia, and you need to ask them questions. Now, if you look at the chart, you will see that some of the categories are about the current condition. Some of them are about support at home and transportation. Okay? And you know the patient was already admitted. So you could say something along the lines of, I'm here today to ask you some questions to see how you are recovering here in the hospital and possibly plan your discharge. Because we know especially the last two categories are more about going home and how the patient will take care of themselves once they are at home. And that is your introduction. The next part of your roleplay one is basically asking the questions, dealing with each category. So go through the category one at a time. The very first thing you will do is to use a transition word. So you could say first, the first set of questions, next, following that. And you will need to do this for each category. After you use the transition word, you will need to actually explain the category or introduce the category. You cannot just jump straight to the questions without losing points, of course. So to give you an example, you could say, remember our first category was pain level. So you could say, first, I would like to ask you some questions about pain, because pain is an indicator whether your condition is getting better or worse. So when you introduce a category, you can explain how is it related to the current condition? Why do you need to know that information? How is it going to help you assess the patient? Keep these questions in mind when you explain them. After you use the transition word and you introduce the category, it's time to ask the questions. The very first question you ask for each category should be an open-ended question. Open-ended just means a little bit broader questions that will give the patient a chance to give you more information. So if you think for pain level, a typical open-ended question could be, how are you feeling today in regards to pain? And you notice it's not asking for a specific detail, like where is the pain located? What's the pain scale? Is it sharp? Those come later on. First, just open-ended question. And after you asked your open-ended question, now it's the time to ask more questions. You will need to ask about 3 to 4 questions for each category in order for you not to miss any information, because the examiner's chart has all the information that you need to obtain. If you don't obtain all the information, obviously you're going to lose points for content. And they will give you clues along the way. So listen to what they say and then make your next question. So some other questions you could ask for pain level could be, on a scale of 1 to 10, with 1 being a slight amount of pain and 10 being the worst pain you have ever felt, how would you rate your pain right now? Is that with or without medication? Talking about the pain level. Where is the pain located? Is it localized or does it radiate? Is there anything that makes the pain better or worse? Is the pain continuous or does it come and go? How would you describe your pain? As you can see, there's a lot more than 2 to 3 questions here. You need to listen to what the patient tells you and then ask the appropriate questions, because each category has a lot of questions that you can ask, but you need to ask the correct questions in order to get the information. So listen to your patient. And then once you did this for every category, once you use the transition, you introduce the category, you ask one open-ended question, you ask 2 to 3 closed-ended questions, you're done with all the categories, we come to the ending. The very first step in the ending is to let the patient know you are done. Unfortunately, you cannot say, I'm done. Right? You could say, though, these are all the questions that I needed to ask you, or you could also say, this is all the information that I needed from you. Then you move on to the next part of the ending, which is to allow the patient to add any information that they may have. They usually don't, but it's one of the strategies to allow them to add that information. Is there anything that you would like to add? And then the last part of your ending is to let the patient know what will happen next. In roleplay 1, the doctor's assessment is always the next step. Tell the patient, I will give this chart to the doctor and they will come and assess you shortly. Now keep in mind that all of these phrases in the introduction and all of the phrases in the ending are just examples. Try not to memorize this because you will be deducted points if they feel like you have memorized something in your response. Make sure to use your own words and try to keep it as natural as possible. Next, we are going to talk about how CELBAN examiners score your speaking. And I'm saying examiners because you will be marked by 2 examiners. These are the criteria that examiners use to mark your response for speaking. And that's not just for roleplay 1, it's for everything. General use of language, intelligibility, and that is worth times 3. So wherever points you get for this is times 3. Organization, fluency and use of cohesive devices. These are your transition words. Adequacy of vocabulary for the purpose, grammar, and use of strategies. And as you can see, grammar is times 2. So again, it's worth twice as much. These may not mean much to you because they're quite technical words. So let's see what they mean. In your general use of language, you need to be effective in most interactions. You need to take initiative with some confidence. They understand that this is a speaking exam and you're a little bit anxious, or you might be a little bit anxious. Speak up. You need to appear confident even though you may not be during that time or at that time. Next, we have intelligibility and pronunciation. And remember, this was worth times 3, meaning can they understand you when you speak without having to concentrate a lot? Even though they may ask you sometimes, what do you mean by? It's okay, don't panic, that's normal. For a level of 8, they expect that. But can they understand the questions you're asking? Do they make sense? Or your pronunciation may not be clear enough. Next, we have organization. Do you organize the text according to your audience? Do you give main ideas and supporting ideas? And do you present them clearly? This is especially important for the probing questions. Next, we have fluency and cohesion, the way your response flows. If the ideas are connected to each other, do you jump back and forth? Is it difficult to understand or to follow your role play or your probing question? It's okay if you have some pauses in your response, but if you stop too many times, if you have too many that's going to affect this. For roleplay 1, did you get all the information or you missed a lot of it? Next, we have vocabulary. For roleplay 1, this is basically how do you use the categories that you have? Do you understand them? Can you ask appropriate questions based on the categories that you have? After this, we have grammar. And again, remember, this is times 2. And it says communication is rarely impeded by occasional grammar errors. It's okay to have some grammar mistakes, but for roleplay 1, it is very important to ask grammatically correct questions. It is also important to use a variety of simple sentences and complex sentences. And last but not the least, you have the strategies that you use. The first strategy is to affirm. Next is asking for clarification. So if there's something that is ambiguous, like if the patient says, for example, I drink wine once in a while, you could say, you mentioned that you drink wine once in a while. How often is that? Remember, they want you to ask between 3 to 4 questions for each category. And if you use all these 3 strategies, that means you are at a level 6. Now, if you want to go to a CLB level 7, you will need to add more strategies. If you think that you misunderstood something, or if you are unsure whether you got the correct information, ask the patient, I'm sorry, I didn't get that. Could you please say it again? Or you could say, you mentioned such and such. Do you mean this? So if the patient says to you, for example, my job is very hard, that could mean different things, right? The next strategy is to establish rapport. You need to be friendly and still professional. Okay, so don't forget to smile, allow the patient to speak when they're speaking. Try to make it as a conversation, show empathy when you need to show empathy. That's very important when you create rapport. Make eye contact. And the next strategy for a CLB level 7 is to repeat back. When you're asking questions based on what the patient said, repeat it back to them. So now you are at a CLB level 7 in terms of strategies. Let's take you to a CLB level 8. You will need to use all the other strategies we talked about, plus a few more. Rephrase. Remember we talked about repeating back? This is very similar, but you're going to use your own words. If you make a mistake, self-correct, and you use appropriate tone and register. This relates a little bit to establishing rapport. These are all the strategies that they are looking for when they mark your speaking roleplay 1 in particular. So now let's do the sample roleplay. I will read to you the instructions so that you have an understanding of what the scenario is and who your patient is. So it says, you're a nurse in a medical ward in a hospital. Your patient was admitted with a diagnosis of pneumonia. Task 1, which is roleplay 1, use the form to guide your questions. For each topic, ask the questions you need to obtain the information from the patient. For example, to get information about the pain level, you will need to ask questions about his and or her pain and so on. Do not write the answers on the form. And then they will give you some time to look at the chart. Whenever you're ready, you can begin. So tell the examiner, I'm ready to begin my roleplay 1, and then begin. Okay, so let's see the sample video interview that I prepared for you. Hi, my name is Susan. I'm one of the nurses in this medical ward, and I'll be taking care of you today. Just to verify that I'm talking to the correct patient, could you please state your name?
John Smith.
And how would you like me to address you?
John.
Okay, John, I can see in your chart that you were admitted with pneumonia. So I'm here to ask you some questions in order to see how you are responding to treatment and possibly plan your discharge for later. Is this a good time?
Yeah.
Excellent. Now, to begin with, I would like to ask you about your pain level because pain is an indicator whether your condition is getting better or worse. So on a scale of 1 to 10, 1 being a slight amount of pain and 10 being the highest pain you've ever felt, how would you rate your pain right now?
It's about 2 out of 10 right now.
Okay. You mentioned it's 2 out of 10 right now. Is that with or without medication?
That's with Tylenol.
I see. Without Tylenol, how would you rate your pain?
It's about 6 out of 10 without Tylenol.
Okay, so a 6 out of 10 without Tylenol. Could you show me where is your pain located?
I have pain in my chest when I cough, breathe deeply.
In the chest area. Next, I'm going to ask you some questions about your history of pneumonia. This is to help us understand if this is a reoccurring condition. Is this the first time that you've experienced pneumonia?
This is the first time I ever had pneumonia.
Is there a family history of pneumonia?
Not so far.
Okay. When did it start? When did you start feeling the symptoms?
About 4 or 5 days ago.
I see. Now, I would like to ask you about some other symptoms aside from the pain that you might be experiencing. This is to help us understand how to treat your condition better. So, aside from the pain, are there any other symptoms that you are experiencing right now?
I seem to cough a lot, especially when I'm laying down.
I see. And is this cough productive or is it a dry cough?
Productive.
You mentioned your cough is productive. Did you see what color is the phlegm?
Clear now.
Oh, that's good. That's a good indicator. Are you experiencing any fever right now?
No fever now.
Any difficulty in breathing?
No.
Next, I would like to ask you about your lifestyle. Some of the lifestyle choices could trigger your condition, so we would like to see if maybe it's a lifestyle choice that caused your pneumonia. So, do you drink coffee?
1 cup of coffee in the morning.
Okay. And do you drink any other caffeinated beverages like soda or soda with caffeine or tea?
No tea or other caffeine sources.
Okay. How about tobacco? Do you smoke?
I used to smoke, but not now.
Oh, that's nice. I'm sure it wasn't easy to quit. When you used to smoke, how many packs a day did you smoke?
About a pack a day.
And how long ago did you quit?
Quit 10 years ago.
Nice. That's a long time. And do you drink?
I drink wine once in a while.
Okay, and when you say once in a while, how often is that?
1, 2 times a month when I'm out for dinner.
Okay, that's I would call that casual drinking. Good. Next, I'm going to ask you about allergies. Because of your difficulty in breathing, any allergic reaction could worsen your condition. So, are you allergic to any medication or any food?
I'm allergic to Brazil nuts very badly.
So, you mentioned you're allergic to Brazil nuts very badly. What happens during an allergic reaction to Brazil nuts?
My throat starts to swell shut.
Oh, I see. And when was the last time that you had an allergic reaction to Brazil nuts?
About 2 months ago.
I see. And how do you manage your allergies?
I try to avoid them.
Yeah, that's smart. Now, in the event that you are discharged today, we would like to make sure that you have the adequate support at home to help you recover. So, I would like to ask you about your support at home. Do you live alone or with your family?
I live alone, but my sister lives nearby and comes over to help.
Okay, so you mentioned that your sister lives nearby. That's really nice that she can help you. How often can your sister come by to help?
2, 3 times a week.
Okay, 2 or 3 times a week, that's good. And do you think your sister could stay with you for a few days until you fully recover?
Yes, she can.
That's nice. And in the event that your sister is not around, do you have somebody else that can help you?
I can have my mother to help me out.
Okay, next I'm going to ask you about transportation. If you are discharged from the hospital, I need to make sure that you have a safe way of getting home. Do you have somebody that can come pick you up once you're discharged?
My sister would pick me up by car.
Oh, that's nice. Your sister seems to be very helpful. Would you like us to call her once we know about the discharge, or can you contact her yourself?
I can contact myself.
Okay. Good. And how far is your house from the hospital? Just to make sure that you're not traveling long distances as you're still recovering.
It's about 15 minutes drive.
Okay, that's good. Okay, so thank you so much, John, for all this information. I'm going to give this information to the doctor, and he will come and have an assessment shortly. Is there anything else that you would like to add to your chart before I give this to the doctor?
No?
So that's everything you need to know about CELBAN Speaking Roleplay 1. Hope you found this video insightful. If you did, don't forget to comment if you have any questions. Subscribe if you want to see more videos. And I'll see you next time. Good luck on your exam if you're taking an exam soon. Bye bye.